Hello, my name is Allison Warner. I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene, and she's been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. Good to see you again.
Wow, Allison, listening to you that 30 years, wow, that sounds like a long time. And it makes me think about all of the changes that were implemented during HIV pandemic.
Yeah.
And there's several similarities between the changes that we implemented in the oral health profession during HIV and the changes that we're implementing now during SARS-CoV.
Yeah.
So yeah, and we continue to get a lot of new information from OSHA and from CDC and the FDA. And of course, it's all been the hot topic in the news about the vaccines. I have to use the plural now because not only do we have the Pfizer vaccine, but Moderna is close to getting approval after their phase 3 testing now also.
Yeah. Well, we're going to talk again about the surge. We talked about it last week, but the surge in cases nationwide is everywhere. It's the top of the news every day. And with Thanksgiving coming up next week, things could get a little dicey for all of us. So last Friday, I know the CDC released its latest MMWR, which is the Morbidity and Mortality Weekly Report, and it's specifically focused on a small wedding reception in Maine that led to a very large COVID outbreak in the community. And Jackie, I know the reason we're going to talk about this is because it actually has applications to the orthodontic team, right?
You're right, Allison. And I think part of this scenario that happened that spurred the CDC investigation into the wedding reception is that we, and I include the entire United States as a social community, we're going through COVID fatigue now.
Yeah.
We've been since February, March, we've been isolating at home. We've been wearing the mask and we've made all the changes in our work environment, and people are tired and they're lonesome and they want to get back together with their family and their friends. And so there's that risk to say, drop your guard a little bit. And this wedding reception is a good example of how highly infectious the SARS-CoV-2 virus is. And the risk that you take when you're in a large gathering. And 55 people, that's the number of attendees at this wedding reception. That's not a really large gathering.
Yeah.
So let me review what happened with it and what the Maine CDC, then the state of Maine, and then what CDC federal published about this particular incident that they did investigate. On August the 7th at the Big Moose Inn in a small community in Maine, population less than 5,000 people, there was this wedding reception. The bride and the groom's family flew in from California to Maine for this. And they were tested for COVID and tested negative prior to it. So they didn't have to isolate. That's the law in Maine, that if you come in from an outside state, that you should isolate, for 2 weeks after coming in. So they did go ahead and have the test. And the Big Moose Inn took temperatures of all of the guests as they entered. And they did screenings, and the Big Moose Inn had the sign up, said, everybody wears a mask as you come in and practice physical distancing. So, and please let us know if you have any symptoms. And all of us have seen those CDC posters that we have up in facilities. Well, the wedding reception party was put in one large room of the Big Moose Inn. And that room was only supposed to accommodate 50 people. Yet there were 55 wedding reception guests. And once everybody had been tested and entered the room, the wedding reception guests decided to take off their mask.
Well, they weren't tested, they just had their temperature checked, right?
Yeah, they had their temperature checked.
Yeah.
Only the groom and the bride and the groom's family were tested.
Right.
But they, oh, excuse me, you're correct. Thank you.
Yeah.
They did the temperature scanning on them, and they asked about symptoms. So
Mhm.
then once everybody got into the banquet room, if you will,
Mhm.
and they had about 10 tables there, and the tables all seated 4 to 6 people with it, many of the guests took off their mask.
Wow. Yeah.
And wedding receptions, they last 2, 3, 4 hours. And then the next day, one of the guests developed symptoms
Mm.
and went for a test and tested positive. So
Mhm.
all positive tests are reported to the health department. The next day, there were 3 more people in this small community that were tested and tested positive. Those are reported to the health department. And in Maine, when you have more than 3 people that test positive that are outside of a family pod,
Mhm.
then that becomes a focus of investigation to
Mm.
determine how was the disease transmitted. And that's when CDC went in to do the investigation.
Mm.
The final result was that out of the 55 attendees, 30 of them developed COVID. They became infected. That's
Yeah.
over a 50% infection rate with that one exposure. Now, 27 of them were actual wedding guests.
Okay.
One of the others was one of the staff members, possibly serving them.
Okay.
Another was one of the vendors, as they say. It could have been somebody that was providing the beverages,
Mm.
maybe, brought in. And then
Flowers.
one was another diner that was not even part of the wedding party,
Okay.
that was just happened to be at the same inn with it.
Mm.
So as people were moving about, maybe going to the bathrooms or even the ventilation system, that could have caused cross contamination.
Yeah.
From this community exposure, those wedding guests, well, one of the wedding guests happened to get together with a friend of theirs that worked at a long-term care facility, a nursing home. And from that, there was an outbreak at the nursing home, and 6 people died as a result.
Yeah.
And then another one of the wedding attendees worked at a correctional facility, a prison, that was almost 200 miles away, and the infection was spread there. The total number of infections spread was 177 from one
Yeah.
wedding guest reception. So that gives us, and all of this happened within less than 1 week. That's
Mm.
how highly infectious this virus is. So
Okay.
I think this is a urgent reminder to us that in social circumstances, we do have to continue to practice all of the recommendations from CDC to prevent the disease transmission.
Yeah. Yeah. Exactly. Well, this was a community event. So what's the takeaway for the orthodontic team then?
Well, when I looked at the numbers, I thought this is very similar to what happens in an orthodontic practice.
Hmm.
There could well be 55 patients and team members come through an orthodontic office every day.
Oh, yeah.
And if there's a lapse in wearing mask, if someone takes theirs off, say at lunchtime, you want to celebrate and you take that mask off, there's a risk of having that infection spread if it's greater than 15 minutes. And that can be, it doesn't, as CDC identified with another outbreak, it doesn't have to be a continuous 15 minutes. It could be
Hmm.
5 minutes here, 6 minutes there, 9 minutes at another exposure to someone who is positive with it.
Right.
So I think this increases the importance of us maintaining our precautions in the orthodontic practice and being socially responsible. As the orthodontic team members looking at going home for the holidays, having
Yeah.
Thanksgiving, continue to practice the physical distancing. CDC actually at the end of the MMWR report listed
Mhm.
5 precautions that we should all be paying attention to in our
Mm.
social and in our work lives. And with those 5 precautions, number
Mm.
1 was to limit large gatherings.
Yeah.
Keep them under 10 people.
Hmm.
The smaller the group, the less risk that there is.
Yeah.
Practice physical distancing greater than 6 feet when you don't have a mask on. And then the other one is practice hand hygiene, washing and your hands frequently, using alcohol-based hand rubs, and then wear the mask.
Hmm.
I can even wear the mask while I'm preparing a Thanksgiving dinner or if I have another family member that has been out and about. And then finally in there, stay home if you're sick. So
Yeah.
those five elements are what's preventing the infection. The other thing that CDC listed in this MMWR, and part of it was, what are the high risk of social gatherings? And this has been put out by CDC as we're coming up on the holidays to remind all of us what we
Yeah.
can do to prevent disease transmission.
Mm-hmm.
And number one, the lowest risk is if we do virtual Thanksgiving.
Yep.
And then a greater risk is when you get smaller outdoor gatherings. So maybe you're in a nice area where you can eat Thanksgiving dinner outside at a picnic table and
Yeah.
be physically distanced apart. Higher
Mm-hmm.
risk is when you have a greater number of people and they're from different families, different locations, and
Mm-hmm.
they get together inside, and the space is, they can still physically distance that 6 feet apart. So
Yeah.
that's considered even a high risk by CDC. The
Right.
highest risk is you get together more people than 10 people
Mm-hmm.
and they can't physically distance. So remember that as we get together for the holidays and practice those 5 precautions
Yeah.
from CDC.
Mm.
And I think with the orthodontic office, I'd like to take the time to relate an incident that happened to me just
Yeah.
this last weekend as an
Yeah.
infection control consultant. I had a text message from an
Mm.
orthodontist, and she said, "Oh, our receptionist, her husband tested positive for COVID. What should we do?"
Mm.
So this is Friday at the end of the week, and over
Okay.
Saturday. And I've consulted with this office. I've even been into the office. So
Mm-hmm.
I know how clean and compliant they are. They're very conscientious with everything. And I got with the doctor and I said, well, let's go to the ADA's COVID-19 risk assessment with it and look at the chart. And if you look at that chart, on the far right side of it, it actually says having a dental staff member whose family member tests positive. So this might be a spouse or a child.
Mm-hmm.
And then when you follow it down, it says that that dental staff member, orthodontic team member, should isolate at home for 10 days.
Okay.
And if no symptoms, then they can return to work.
Okay.
Well, if they develop symptoms within that 10 days, then you go down to the next box. And the next box says to isolate at home for an additional 10 days from the start of symptoms.
Mm-hmm.
And then you would go back to the healthcare providers return to work. When can they return to work? And
Mm-hmm.
those 3 conditions are, number one, that they have no fever, and they haven't had any symptoms without no fever without fever reducing medicines, no
Okay.
symptoms, and that symptoms have reduced or with it. So the CDC has actually laid out the precautions for us
Okay.
when employees can return to work after having had an infection. So it's pretty
Mm-hmm.
straightforward. And as I told the doctor, I said, I know you're practicing universal source control. Everybody's
Mm-hmm.
wearing their mask when, and you're doing temperature screenings and checking symptoms. And again,
Mm-hmm.
that's a screening, because as we saw at this wedding reception, the wedding
They
guest
did it.
passed.
Yeah.
Yeah, but then the next day, so they were
Mm-hmm.
in that asymptomatic 2 to 3 days
Yeah.
before showing symptoms. So it's not a guarantee. It's
Right.
a
Exactly.
screening, an
Mm-hmm.
indication with it.
Yep.
So going back to the orthodontic incident, the receptionist, well, she was all worried, and the doctor said, well, what should we do? I said, well, just what ADA recommended. Well,
Mm-hmm.
out of concern, the receptionist took her 2 sons to be tested also, because the dad and one of the sons returned positive. So,
Wow.
maybe the child acquired it at school, at an athletic activity or whatever. And then, as greater precaution, the receptionist went to have her self-tested, and she tested positive. Now the whole team is anxious.
Yeah.
And the doctor's anxious. Oh my gosh, what should we do? And again, I
Mm-hmm.
went back to the doctor and said, well, you're practicing universal source control. You haven't had any lapses, have you? I
Yeah.
mean, I know you've got a small staff lounge. Everybody is, at least 6 feet away when you're eating, and you're
Mm-hmm.
staggering lunches. And then I get this text message back from the doctor. Well, last week we had a photographer come in to take some professional practice photos. And when I'm reading all of this on text messages, and I said, were you wearing mask? Well, most of the time we were, but we did a team photo and we took our mask off. Now, for any of you who've been involved, when you take your team photos, it takes a while to get everybody positioned right, get the
Mhm.
photographer there, and the photographer's coming over and saying, turn a little bit this way, chin up or chin down. You get all of that arranging takes
Yeah.
probably more than 15 minutes.
Mhm.
So
Yeah.
here, the receptionist who has now tested positive was in the group photo shoot.
Yeah.
So the doctor goes back and she even texts the photographer. The photographer said, oh, yes, I'll go get tested. Thank you for letting me know. And then the doctor said, oh, Monday morning. So all of this is happening over the weekend and everyone's anxious. So Monday morning, the doctor says, oh, yes, I'm going to send every one of the team members to be tested. So the team all goes to get tested. Only 2 team members could get tested because the facility ran out of testing kits. It's an ongoing situation because of
Well,
one short lapse.
yeah. Well, and it's showing all the pitfalls along the way, because running out of testing, there's states or cities are being inundated with people wanting tests right now, so there are shortages.
And
So
infections are rising, and
yeah.
we're even seeing, because of so many of the hospitals and the hospital care teams are using the N95 respirators now. They have so many COVID patients, and
Yeah.
their ICU. So we're going to see a shortage of N95 respirators
Yeah.
again in the
Yeah.
future.
Yeah.
So anyway, at this point, it's still an ongoing case or some case with it,
Yeah.
where the rest of the team is going to be tested. And I'm confident, I've got my fingers crossed that everything is going
Mhm.
to be resolved in a positive way, not positive test, negative test. And everyone is going to be safe with it.
Yeah.
But as I'm looking on social media, on Facebook, on Twitter, and everything, I will caution the ortho teams, just look at every time, every moment in your office that you take off that mask. Limit those photographs that you do at the debond, where
Mhm.
you normally hug the patient and go, look at this
Yeah.
gorgeous smile. Now I'm seeing doctors hugging the patient and the mask is off. It's a short time, but again,
Yeah.
and used to, we'd all come in and sing the D-band
Yeah.
song, as
Yeah.
Rosemary Bray would say to all of our
Mhm.
patients. Those moments, any moment that the mask is off, and it doesn't have to be just a 15-minute one time, it can be segmented exposures with it. So yeah, we need to continue to be vigilant. I know we all have fatigue, but we need to continue to protect. We do have close to vaccine development. It's going to take at least 6 months, if not a year, to
Yeah.
get protection across the population, because first line responders are the hospitals, the long-term care nurses. They're the ones that are going to be vaccinated first.
Yeah.
And
Right.
in the United States, we're only going to be able to vaccinate like maybe 25 million people in
Yeah.
that first round of it. So
Yeah.
it's going to take us a while.
Mhm.
Please maintain wearing that mask and
Yeah.
do all of the 5 CDC precautions during the holidays. Be safe, and stay negative.
Yeah. Well, is there anything else that orthodontic offices should be doing to protect themselves and their patients as we go into the holidays?
With this, I would recommend, again, practicing those 5 precautions as we go into the holidays. And then when you come back into the office, I would actually survey each of the team members when you do that first day back screening.
Mhm.
Were you at any social activities that involved more than 10 people? And
Mhm.
were you unmasked for more than 15 minutes
Right.
when you were at those gatherings? And if so, then that's a risk situation, and
Yeah.
you need to look at, does that team member need to isolate at home to prevent the infection from entering the orthodontic office?
Yeah. Okay. Well, Jackie, again, thank you for this information. Here's hoping that everyone takes precautions and is very careful over the coming weeks so we can get this past this surge. We actually will not be back next week because it will be Thanksgiving. So
Yes.
we're going to take a little hiatus and we'll be back in 2 weeks with the next episode of In the Sterilization Room with Jackie. And hopefully by then we'll have an update on that orthodontic practice and how things turned out with their tests.
Yes.
Provide that. And in the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.
Thank you, Allison.
Thanks, Jackie.